Hello, Dr. Rachel's office. This is Nurse Kathy. How can I help you?
Well, hello, Kathy. I'm so glad that you got a little time for me here. You know, the reason I'm calling is we were just David and I, on our appointment, and I didn't want to upset him by sharing these things in front of him. But I have to tell you, I'm actually I'm concerned. He just doesn't seem quite right.
I'm very sorry to hear that you are concerned, Carol. Can you tell me a little bit more? What specific things worry you?
Well, um, he's been hanging out in his room a lot more, watching more TV than he used to. He used to be a voracious reader and he'd been in the den a lot reading, in the afternoon and evenings. Now he's up in his room just watching TV all the time. It doesn't want to seem to come out. One of the other things that doesn't seem to be quite right is he used to be quite social. And, when people come over, he doesn't want to see them. He just goes up to his room. That doesn't seem to be right either. I mean, something's off. I can't quite put my finger on it, but that's just a few things I've noticed.
All right, thank you for sharing your observations. So changes like this are to be expected over time, but we want to pay careful attention and really notice if something changes more suddenly. So have you noticed any behaviors or mood or physical changes that were a little bit more abrupt?
You know, I don't think there's been anything actually, quite frankly, I can't recollect. I can't put my finger on that either.
Okay. Do you keep a care log or any other tracking mechanism where you jot down your observations or kind of journal, pay attention and write down changes in his mood, behavior, physical symptoms, for example, if he has any pain, changes in his sleep, bowel movements, appetite? What system do you use to record those day-to-day observations?
Oh, wow. Oh, actually, I don't use anything. I never even thought to do it at all.
That's okay. That's all right. So if it's okay with you, I would like to email you just a simple tracking form, a care log, that's going to give you prompts for, it's very helpful if you could do this daily, kind of writing down your observations and also noticing if you could think of what triggered some of these changes or if something that you have done or something that happened that made things better. So if I could please ask you to keep track of those observations for about a week, and then we'll schedule a follow-up call on Zoom and we can look at these care logs together. How does that sound?
You know what? I'm willing to give it a try for sure. Yeah.
Wonderful. So we'll reconnect again in a week and maybe send me your care logs. You can email them back or use David's patient portal so we can take a look at them together, okay?
Sounds like a good idea. I'll probably email them in.
Okay. All right, Carol. So looking forward to connecting with you in a week.
Okay. Sounds like a plan.
Goodbye.
Bye-bye.
Well, hello, Carol. How are you today?
Well, I'm not doing too bad. Thank you.
Well, I am very glad that you done your homework and thank you very much for sending all your tracking logs to me ahead of time. So I had a chance to take a look. So I'm going to share a screen with you and we're going to look at them together. So thank you for carefully recording the medication log. I compared it against our records and it looks like our records coincide. So we have recordings of the same medications and over the counter vitamins and supplements that David is taking. Are there any updates to this log or this is the most current record that you have?
Well, yeah, everything is pretty current, except we have just backed off on the Tylenol just a little bit.
Okay, excellent. So make sure to note this in your medication log so you can share it with all other healthcare providers. Now we're going to take a quick look at the appointment log. And I think you would find it very helpful. Again, thank you so much for taking these very careful notes. So last time when you saw Dr. Peterson, you and Dr. Peterson identified several concerns as wandering at night and sleeping during the day. So the recommendation that Dr. Peterson made was to try to reduce the caffeine, look into enrolling into the day program, and overall increasing activities and exercise during the day. Can you just give me a brief update? What were you and David able to accomplish? And did any of the symptoms of wandering at night and sleeping during the day improve?
Yes, well, we are trying to get to bed at a regular time, consistent all the time. The other thing we're trying to do is to not watch TV at night after we go to bed, because that can keep, I think that can keep him awake, and me too, of course. We're trying to actually be a little bit more active during the day and get a little more exercise, so that there isn't as much sleeping. He doesn't take as many naps during the day, because all that activity too at night will help. I mean, all the activity in the daytime will help his sleeping patterns at night. I mean, I know it helps me. You know, as far as a day program, I haven't really talked with him about that yet. I just want to try the exercise and have him be in more of a routine, you know, in the, you know, see what we can do there before we try to enroll in the day program. I haven't installed safety locks or anything like that yet, although I know I need to. That's incredibly important. But I need to do it kind of on the sly here a little bit too. Yeah, I think we're moving along on these things.
Thank you very much for the update. And finally, we're going to take a look at the care log that you kept. Again, thank you very much for keeping these notes and observation. I think it's going to be very helpful for you and I to look at it together. So what I see when I look at your very careful care log is that it started about a week ago when you noticed that David was feeling kind of drowsy during the day, fell asleep watching TV. And it seems like he became more kind of angry and irritable as the week progressed, right?
Yeah.
And then you were noticing he was sleeping worse and worse, and maybe was already sleep deprived by the end of the week. And then yesterday, your most recent log entry, you were saying that you went to the mall and he was more confused, not just irritable. And he was very anxious. So this is very helpful to kind of see the progression of the symptoms. And it's a bit concerning for me because based on your timeline, the onset of his daytime sleepiness and irritability was quite sudden, right? So it didn't have a gradual kind of course. Is that correct?
Yes.
Okay.
Yeah, that's correct.
Okay. So because of this sudden onset, I think it would be really important for David to come in to actually in-person appointment to see Dr. Rachel and to maybe do an exam and maybe do some lab work. And I would like to schedule you to come in within the next week. Would that be possible?
Yes, it would be. And quite frankly, the sooner the better.
Okay,
We'll take the
excellent.
first available appointment.
We will do that. But in meantime, please continue doing what you've been doing. All the strategies that you described and increasing activity during the day and setting up better nighttime routine would be very, very helpful. I'm also going to give you, send you some more recommendations for improving sleep hygiene. And I'll send you some links to sit and be fit exercises that maybe the two of you can do side by side, and some other recommendations. And connect you with my colleagues at the Alzheimer's Association who can give you even more recommendations kind of for non-medications and related interventions. So I will send all this information your way, but we do want David to come in for an appointment. I also want to encourage you to continue keeping wonderful records that you've been keeping, because, you know, for me as your nurse, as David's nurse, it's very helpful to see all this history. And I hope that you find also helpful to you as a care partner.
Actually, it does. It does help me capture everything. And, you know, because some of this is actually quite upsetting. So it helps. Yeah, it's a great idea.
Well, thank you very much, Carol. I really appreciate all that you do. And I hope that you're also taking care of yourself. And we are looking forward to seeing you and David in just a few days.
Great. Well, I look forward to that appointment.
Wishing you a wonderful rest of the day.
Great. And you too. Thank you so much.
You are very welcome. Bye-bye.
Bye-bye.